The following video may contain subjective opinions and sensitive topics not suitable for children. If this is a serious problem for you, it's probably best if you don't watch this video, although you will most likely regret. Mental illnesses have been a part of humanity ever since we existed. Disorders like depression, schizophrenia, or obsessive-compulsive disorders have been known to us for thousands of years now in one form or another. And there's evidence that humans even attempted helping those with mental problems as long as 66,000 years ago. Considering this, it's no surprise that over the years contemporary philosophers, psychiatrists, and doctors came up with hundreds, if not thousands, of different methods of treatment. And while some of them were definitely helpful and are used to this day to treat mental illnesses, the truth is the vast majority of the so-called treatments were completely stupid and caused more harm than good. And today, that is exactly what we're going to investigate. So, if you want to find out why vibrators were once prescribed by psychiatrists, or why some laxatives are named after one of the founding fathers, then join me as we go through the dumbest methods of psychiatric treatments. But before we start, let's just quickly define what psychiatry actually is. Psychiatry is a word coined from the ancient Greek words psyche, or mind, and iatria, or healing, and was first used by the German physician Johann Rau in 1808. But obviously psychiatric treatment did exist before, it just wasn't known as psychiatry. So, to kick off our list, we have purging. And don't worry, don't be intimidated by its name. As far as being a terrible way of treating anything really, purging did not involve any murder, or at least it didn't aim to do so. You see, purging is a term used to describe the expulsion of food from the body by the use of laxatives. This questionable approach dates way back to the Roman Empire when a certain encyclopedist, and yes, I did have about 50 attempts at saying this, named Aulus Cornelius Celsus, argued that the key to treating mental disorders are laxatives. That's right, Celsus believed that depression could be excreted. And as I've already mentioned, he wasn't even a doctor, but this did not stop him from writing 8 books about medicine. I mean, he was a writer, so why the hell not, right? And now you may wonder, how in the hell is vomiting and pooping gonna treat mental illnesses? The answer is, well, there isn't really an answer. It just didn't work, obviously. But that's not all, because for patients who weren't so optimistic about his treatments, he recommended fist therapy. And no, this isn't some sophisticated treatment technique that you just haven't heard of. He actually recommended beating the hell out of patients as a form of treatment. This dodgy form of treatment continued to be used up until late 19th century, when psychiatrists finally realized that it may take a little more to treat depression than simply shitting it out. Which, by the way, sounds like a great thing to say to your friend when they're feeling a bit down. But before this could have happened, the world would see yet another rather controversial doctor/inventor, Benjamin Rush, who, by the way, was one of the founding fathers of the US, which is definitely something that you could say the pub somewhere in Texas, and even get some respect for your knowledge, but I would probably advise against adding that he was also completely out of his mind. He believed, for example, that black skin color is a genetic disease that can be treated. But what interests us more today are his psychiatric inventions. One of them were laxative pills containing mercury. That's right, the incredibly toxic and dangerous metal. Apparently they work so fast and so well that people soon started calling them Rush's Thunderbolts, which is a great and very fitting name. So next up, we have another one of those practices that for some reason was just accepted by basically everyone for thousands of years, and no one seemed to question how it would actually help in anything. So what was phlebotomy, or bloodletting, used for? Well, just about anything. You had depression? Great, I'll just take some of your blood and you'll definitely feel better. Maybe you suffer from a fever, smallpox, or even gonorrhea. Well, okay, a liter of your blood should fix the problem. Looking back at this, I'm really convinced that vampires did exist back in the day and just worked as doctors. But let's get back to our topic. Did bloodletting therapy work? Miraculously, it's actually no, of course it didn't. In most cases, it actually worsened the patient's condition. The practice of bloodletting dates back as far as to ancient Egypt, where it would be observed that the hippopotamus scratched themselves to relieve the stress, as they were often covered in a red, blood-like substance. But in reality, the substance was just sweat that resembled blood. So yeah, well done, Egyptians. This bloodletting trend continued to be used in ancient Greece and Rome, where it gained even more popularity with the works of Hippocrates, who openly said that bleeding a patient to health resembled female menstruation, which purges women of bad humours. And obviously this wonderful practice wouldn't end there. In fact, it was just the beginning, since its golden age is said to be the 18th and 19th centuries. But there are still many people who believe that this works to this day. And to give you some idea of how popular bloodletting was back in the day, just listen to this. Remember when I said that it was used to treat just about anything? Well, I wasn't kidding. One day, Charles II, or the King of England in the 17th century, found himself in a terrible state as he experienced a seizure. But luckily, his team of experts was near, so he was immediately treated with, that's right, bloodletting. And that wasn't just some ordinary bloodletting, oh no. In total, he had 24 ounces of blood taken in just a couple of days. And here's a little quiz for you. Have a guess what caused his health problems in the first place? Mercury poisoning. That's right, before his seizure he was also treated with laxatives containing mercury. It's a small world we live in, isn't it? Another notable example was George Washington himself, who, after developing a fever, was treated with the amazing practice of bloodletting. And obviously they had to use purging as well. I wonder if they used Rush's Thunderbolts, considering he was pretty close to George Washington. Okay, so to give a bit of a break for our ancestors, let's talk about some of the more modern treatments now. Metrazol is a stimulant drug discovered by a Hungarian-American psychiatrist, Ladislav Meduna, in 1934, who theorized that since people with epilepsy often feel better after a seizure, inducing a seizure in people with other mental illnesses like schizophrenia would also help them recover, which is probably comparable to saying that chemotherapy must work for diabetes since it helps with cancer. Metrazol therapy belonged to a broad category of shock therapies developed at the start of the 20th century. And no, it didn't involve showing patients brain rot TikToks or one of Mr. Beast's videos, but rather it describes a set of treatment methods which aim to treat mental illnesses by causing seizures in patients. And once again, I'm not sure how that's supposed to work, but fine, let's just accept this, why not? What's interesting is that this rather stupid form of treatment, despite many side effects including bone fractures from the extreme convulsions caused by it or brain damage caused by the toxicity of metrazol, was not banned by the FDA until 1982. And unfortunately, shock therapy, but now in the form of electroconvulsive therapy, is still used to this day. Although research relating ECT is mixed, so I won't make any opinions on this, but it's definitely an improvement from metrazol. Okay, we all knew it was coming, so here it is. And I do realise that lobotomy is probably the most criticised and popular example of psychiatric treatment, but it's just too big not to talk about it. So what is lobotomy? It's a surgical procedure popularized by the Portuguese neurologist Antonio Egas Moniz in the 1930s, who, by the way, was awarded the Nobel Prize for his work. The origins of lobotomy, or rather leucotomy since the name lobotomy was created later, dates back to 1935 when Moniz would perform his first ever brain surgery. His patient, a 63-year-old woman with depression, anxiety, paranoia, hallucinations, and insomnia, geez, she really wasn't lucky, was she? Experienced a rapid recovery and was observed to be much calmer and better functioning following the surgery, leading Moniz to conclude that his treatment was effective. And with that conclusion, a psychiatric revolution was soon to come. One that would have severe consequences for sufferers of mental illnesses. Throughout the 1940s, 50s and 60s, over 50,000 lobotomies would be performed in just the US, with most of them taking place in just 3 years between 1949 and 1952. And with the popularization of leucotomy on such a broad scale, new versions of the procedure were sure to appear. A key figure in the history of lobotomy, Walter Jackson Freeman, upon learning about Moniz's revolutionary procedure, would become fascinated with leucotomy, and just a few years later, in 1945, he would come up with his own unique version of leucotomy. Unlike the surgically sound and complex method developed by Moniz that required a whole set of medical instruments and a team of trained professionals, Freeman would simplify this complicated procedure to a simple few minutes long process, with the only tool being an ice pick that would be inserted into the brain through the eyeball. This new version of leucotomy, now known as lobotomy, would be so gruesome and disturbing that it would actually cause Freeman's partner, James Watts, to split apart from him because he was disgusted by Freeman's improvements. In the 1950s, Freeman would embark on a state-sponsored journey across the US dubbed Operation Ice Pick, during which he would perform lobotomies and spread this god-awful practice. He would perform a total of 4,000 lobotomies, despite the fact that he didn't even receive any formal surgical training. The practice of lobotomy would finally start to fade away in the 1960s, with the unofficial end of this rather controversial era of psychiatry being 1967, since that's when Freeman would be banned from performing the procedure. The consequences of this incredibly flawed treatment method could be felt all around the world as thousands of innocent and already struggling people were left in a vegetative, emotionless state for the rest of their life. Yeah, lobotomy is definitely one of the darkest chapters of psychiatry. And to finish this video on a funny note, let's talk about vibrators. You heard me right, vibrators were once used to treat mental illnesses, which, looking back at the other treatments I've mentioned today, wasn't even a terrible idea. You see, during the late 1800s and early 1900s, a certain condition known as female hysteria was a massive thing. If I had to compare it to something more modern, it would probably be a mix of a personality disorder and anxiety disorder. But basically, it was probably the biggest psychiatric trend back then, and most women who didn't fit the social norms would likely be diagnosed with female hysteria. It would be characterized by a very wide variety of symptoms, but the most commonly recurring were anxiety, fainting, sexually impulsive behavior, and insomnia. So essentially, hysteria was just a broad term used for pretty much every mentally ill woman because our knowledge was too limited to come up with something more advanced. But the problem with this solution is that for a very long time there wasn't really any way of treating hysteria, and it was just kind of accepted by people as part of life. Some did try to cure it with surgical procedures like hysterectomy or the removal of the uterus, and others even attempted treating it with therapy, but nothing seemed to work. Until one day, in 1869, which is by the way a very fitting date, an American physician, George Taylor, patented one of the first medical vibrators called, and this isn't a joke, the manipulator. His invention was a large padded table with a hole cut out to reveal the patient's lower abdomen, and through which vibrations would be applied. With a rather serious name and even more intimidating appearance, it quickly became a helpful tool used, or rather bought by doctors. However, Taylor's vibrator did have some issues since it was extremely expensive, large, and it was coal-powered. So, not so long after him, another inventor called Joseph Granville would come up with the first battery-powered, more portable vibrator. And by more portable, I mean it still weighs over 40 pounds, but it was definitely smaller than the manipulator. Following his groundbreaking invention in the 1880s, vibrators would grow increasingly more popular and used by professionals to treat hysteria, until essentially the 1920s when they began to be seen in a more sexual context. And on this note, my list of the dumbest methods of psychiatric treatment has come to an end. Let me know which one of today's treatments was the dumbest in your opinion down in the comments. Thank you for spending your precious time to watch my video, and subscribe if you'd like to see more videos like this one. Okay, see you in the next one. Bye.